Hello friends, again welcome to my channel. Today we are going to discuss about the syphilis. Now the syphilis it is a type of the sexually transmitted disease which is preferentially caused by a spirochete that is the Treponema pallidum. Treponema pallidum it is a causative agent of the syphilis. The treponema are relatively short, slender, fine spirals which are associated with the venereal and the non-venereal diseases, and some of the species of this treponema, some of the strains of treponema, these are non-pathogenic in nature. These spirochetes, these are slender and tightly coiled, measuring up to 5 to 15 micrometer long and zero point zero 0.09 to 0.18 micrometer wide. That these are very much thin in nature. They have a characteristics motility and which is observed under the dark field microscope. This is due to the axial fimbrims which are similar to the flagella which are varying in number. The Treponema pallidum has not been cultured in vivo. It is rapidly inactivated by drying, heat or cold. As these are very much sensitive organisms, so this cannot be cultivated in the common laboratory medium. For the proper cultivation of this Treponema pallidum, preferentially there is the specialized conditions these are applied, or they may be cultivated using the laboratory animals. The transmission of this syphilis it can be possible by the direct contact or by the congenital transfer. Now the syphilis it is conventionally divided into the four stages, that is the primary, secondary, latent and the tertiary. Staging has the prognostic and the therapeutic implication. In the primary stage, majorly it is after the 3 to 90 days after the exposure to the causative agent, that is the Treponema pallidum, and the sores these are appear on the genital organs. The second stage it is after 4 to 10 weeks after the initial infection, and there is the development of the rashes on the body. Within the third stage, these are appear after 3 to 15 years after the initial infection, and the different body organs these are get affected. Now one by one we are discussing about these stages of the syphilis. The first one it is the primary syphilis. After the 5 to 10 80 days after the contact, that is the sexual contact, the cancre develops at the point of contact, that is the external genitalia. The cancre it is an inflammatory lesion containing the spirochetes and the lymphocytes. It is an painless, well circumscribed, indurated, which can be healed spontaneously after 10 to 14 days, leaving a thin scar, which is also called as the hard cancre. The regional lymph nodes are enlarged within this period and non-tender. Even before the appearance of the cancre, the treponema spread from site of entry via the blood or lymph. That is, the transmission of spirochete can be possible before the appearance of this cancre or the lesions. Multiple cancre may be seen in the immunodeficient patient. That is, those of the persons who have the decreased immune response or the immune system. Once this heals, patient remains asymptomatic till the secondary stage. Now the second stage it is the secondary syphilis. 2 to 12 weeks after the primary lesion heals, the generalized symptoms of the disseminated infection occurs due to the multiplication and the dissemination of the treponemas, means due to the growth of the treponemas within the organism. The fever, headache, sore throat and the enlarged lymph nodes develops within this secondary syphilis. Papular skin rash develops on the body parts, and the lesions these are appear on the palms and the soles of the feet also. The abundant spirochetes in the skin lesions these are observed, and it is the most infectious stage within the syphilis. That is, the high number of treponemas these are observed within these cases. The intensity of the lesions in the secondary syphilis it varies, and depending upon the immune system of that organism, it can heal spontaneously in months to years. Now the third one it is the latent syphilis. The latent syphilis, within this the syphilis, that is the Treponema pallidum, that is the causative agent of syphilis, it remains in the latent conditions, that is there is no growth of this organism. So There is absence of clinical symptoms within the latent syphilis, that is, it is asymptomatic. The three possible outcomes these are observed within the latent syphilis. It persists for the life. It may be convert within the tertiary syphilis, or there may be the cure, that is, the persons may be get cure from these infections. The tertiary syphilis. The tertiary syphilis, it is observed 2 to 20 years later. It is divided into the three main groups. That is, it responsible to maybe affect the cardiovascular system. It may be responsible to affect the central nervous system known as the neurosyphilis or the late benign syphilis. One third persons which are having the tertiary syphilis, they may get die. The next one, it is the congenital syphilis. The congenital syphilis, it is transferred from the infected mother to its fetus. The fetus susceptible after fourth month of its life, intrauterine life. 40% fetal death it is observed in these cases. The fetus may be suffered from the Hutchinson's triad. There may be the peg teeth, interstitial keratitis, or the eighth nerve destruction or the deafness it is observed within the babies. Now we are switch over to the diagnosis of the syphilis. On the clinical based systems, majorly the different types of the laboratory techniques, these are available for the diagnosis of the syphilis infection. The first one, it is the dark fluid examination, that is the microscopic examination of the Treponema pallidum, which is an causative agent of the syphilis. Now the wear gloves, clean the lesions with the saline gloves, that is the lesions which are appeared on the different body parts or majorly within the genital organs. These lesions, these are cleaned with the saline gauze. Press it gently and collect the exudate on the slide and examine it under the dark field microscope. Majorly within this lesion, there is the presence of the spirochetes, that is the Treponema pallidum. So these can be observed under the dark field microscope. These spirochetes or the Treponema pallidum, these are preferentially the gram-negative organisms, but this cannot be stained with the normal gram staining procedures. The common test to check the syphilis antibodies include the Treponema pallidum particle agglutination assay, that is the TPPA, fluorescent treponemal antibody absorption, that is the FTA-ABS test. Then the treponemal antibody test to detect the antibodies that target the Treponema pallidum. Non-treponemal tests include such as the venereal disease research laboratory, that is the VDRL test, which is a common test to diagnose the syphilis infection. Within this, the cardiolipins, these are used as an antigens to check the presence of the antibodies against this Treponema pallidum within the suspected person, or the rapid plasma reagent test, that is the RPR test. Then the polymerase chain reaction, which amplifies the specific nucleic acid sequences. Direct fluorescent antibody, an immunofluorescence enzyme based microscopic method, it is applied for the diagnosis. Then the silver staining, a microscopic observation method that eliminates the interference of the mucous filaments and the fibers. So this technique can be also used for the diagnosis. Then in the next point within our discussion, it is the transmission of the syphilis infection. The preferentially the transmission of the syphilis infection, it is caused by having the unprotected vaginal and the oral sex. It is spread through the blood, that is by the blood products, unclean needles or the unscreened blood transfusion from mother to its baby during the pregnancy, labor or the nursing. It can be spread during the practice or the tertiary by the direct contact with the mucosal lesions. These are the some of the transmission routes of the syphilis infection. Then the epidemiology of the syphilis. The prevalence of the syphilis has been growing in the United States or within the UK over the last decades. Traditionally, the syphilis it is common condition, but the incidence it is dropped with the widespread introduction of antibiotics. Whenever there is the discovery of antibiotics, there is the reduction within the appearance of the syphilis infection. There is again the significant increase in the cases in UK between 2013 to 18. Worldwide, there was the more than 19 million cases of the syphilis since 2016. New cases are most common in young adults, that is aged between 20 to 29 years. Up to the 40% of the syphilis patient, they have the co-infection with the human immunodeficiency virus, that is the HIV infection. Within this HIV infection, the host immune system it is get decreased, so due to which they are susceptible to such type of the infection. Then the treatment for the to cure the syphilis infection. Syphilis it is treated with the antibiotics, usually the penicillin antibiotic. The treatment it is dependent on the stage of the syphilis and whether the patient it is allergic to the penicillin. If the patient it is not allergic to the penicillin, there is the penicillin antibiotics these are provided. If it is allergic to the penicillin, then the other types of antibiotics these are preferred for the treatment. The benzathine penicillin, the first line treatment for the syphilis. This BPG is given as an injection. It's also the only WHO recommended treatment for the pregnant woman. Then the doxycycline, ceftriaxone or the azithromycin. These antibiotics are used as the second line treatment. Then the intravenous antibiotics. These are used to treat the neurosyphilis, ocular syphilis or the otosyphilis. Penicillin and the probenic acid. The probenic acid is taken orally to make the penicillin more effective. Then the duration of the treatment. The length of treatment it is completely depending upon the stage of syphilis. For example, the primary, secondary and the early latent syphilis are treated with a single shot of the penicillin. The late latent or the tertiary syphilis which is without the neurosyphilis are treated with the 3 doses of the penicillin. So it is the information about the syphilis. If you like this video, please subscribe my channel and also share this video with your friends. Thank you.